My name is Dr. Shamsa Ahmed. I'm a consultant physician based at the MP Shah Hospital with special interest in infectious disease. MP Shah is committed to serving our community, and that starts with information. We've had a lot of questions and concerns about the COVID-19 virus that is currently causing a pandemic worldwide. One of the things we're being asked at the moment is who is at high risk of getting COVID-19. The truth is currently everyone is at high risk of getting COVID-19. Young age no longer seems to be a protective factor. However, the groups that we are concerned about are the elderly, the immunocompromised, anyone who's on chronic medication. So cancer medication, heart medication, kidney medication, diabetes, these are special groups who need to be followed up by their physician during this particular time. One thing we'd encourage people out there is if you're looking for information, get it from validated sites. The validated sites are the World Health Organization, the CDC, our Ministry of Health, and MP Shah has set up a dedicated hotline where you can always call in to ask any questions concerning COVID-19. Who needs to be self-quarantined? Self-quarantine is not for patients who are sick. Self-quarantine is for people who have come into contact with either high-risk individuals or have traveled from countries that are currently experiencing the same COVID-19 transmission. Self-quarantine means keeping yourself at home. If you're able to be alone in the house, that's even better. If not possible, that means within your house, having a separate bedroom, using a separate bathroom, using different utensils, and doing your best not to come into daily contact with the other family members. Is there a cure for COVID-19? Currently, there is no cure for COVID-19. Is there a vaccine for COVID-19? Currently, there is no vaccine. If you get infected, can you get reinfected? This is a new disease. There's very limited data. We're unable to tell you whether getting COVID-19 will give you any sort of immunity and you won't get it a second time round. So we keep talking about prevention, prevention, and prevention. So the MP Shah Hospital has put into place multiple safety measures to help protect the community as well as their own staff. The first thing is we're trying to decrease the amount of traffic flow within our actual hospital. So you'll find if you do have any relatives or friends in the hospital, we'll encourage you to have only a single visitor coming to see them and to kindly adhere with any security measures that you might find when you come to see whoever is in hospital at that point. We have a very active social media campaign, and that is aimed at disseminating verified information to the public as well as our own healthcare workers as to what to do in terms of COVID-19. We have a special extension of casualty out in the main parking lot to be a place that we can filter and triage patients who are showing symptoms of a cold, flu, cough, history of travel. This way we're going to try and isolate patients who could possibly suspected individuals and see how to get them through the system while providing the appropriate care and attention. Our healthcare workers are being trained daily on how to approach these patients in a way that is safe for them. We have the adequate protective equipment for our staff, and through these methods of daily training and reinforcing habits, we hope to make sure that our staff is also kept safe throughout this epidemic. If you are at home and feeling sick, should you come to hospital, what should you do? There are multiple emergency hotlines. There's the MP Shah hotline, there's the Ministry of Health hotline. I would encourage you not to come to the hospital directly, but to first make phone calls to these numbers, and someone will be there to guide you on what needs to be done, even if it means having an emergency service coming to pick up this particular patient from home. I would encourage everyone not to panic. Panic comes from having lack of information. The more information you have, the more prepared you will be in this situation. So again, look at sites that are verified and not WhatsApp messages which are being circulated within different groups. Do you need to stock up on medications? I would encourage you not to overstock up on medications. I would encourage you not to do panic buying. I would encourage everyone just to be kinder to each other. Lastly, I would say that our hospital is not purely nurses and doctors. Our hospital is made up of many people behind the scenes. So I think the take home from this is if we are coming to work for you, I'd encourage you to stay home for us.